Good morning, Dr. Brownstein. I don't think you need any introduction at all.
I don't know about that, but thank you for having me.
You're welcome. You're pretty famous in this neck of the woods. Calgary speaks a lot about you. I think it's because over the last few years we've had a lot of controversy over the whole fluoride in the water thing. So people looking for alternatives. Lucky for us, they did add it back in June, but they're trying to get an injunction now, to hopefully stop it and reverse the decision. We'll see. Only time will tell.
Calgary's, from my point of view, Calgary's the Wild West. I'm surprised people aren't rebelling against what they don't like.
Yeah, well, Calgary is the Texas of Canada,
Right.
and as much as it's pretty red, as we would say, it seems to be turning a little bit more liberal over the last few years. And though really, this is not where the conversation is, but really the strongest argument they have for adding it back into the water is the teat. That is their argument, and there's nothing else to it. And they won't hear any alternatives.
We'll keep fighting.
We will. So I invited you onto the podcast to discuss iodine and thyroid specifically. And I had your colleague and I believe friend Lynn Farrow on maybe 2 or 3 years ago, and we had a great conversation. Um, and she, of course, huge fan of you, but also references you a lot in her book. And there was a lot of interest in that podcast, like a lot. So I figured now is the time to talk to the man himself.
Lynn Farrell's a lovely lady, and can't go wrong with her.
Oh, she is. She's so sweet. So let's jump straight into it, Dr. Brownstein, because this really is your field. You would be considered probably one of the foremost experts in the world on iodine. So let's start with the basics, if you don't mind. What is iodine?
Iodine is an essential element the human body can't live without. In fact, every cell needs and requires iodine. Um, Now, we've been designed by our maker that we can survive low iodine areas, although low iodine environments. But if we in living in these low iodine environments comes with consequences, and iodine is in the periodic table of elements. It's group 17, which is on the right side of the periodic table, and there's four items in that group. They're called halides, and they're all similar items to one another. And in the order of their size is fluoride, chlorine, fluoride, chloride, bromide, and iodine. Now, of those halides, two are essential that we can't live without. Those are iodine and chloride, and two are non-essential toxic items that have no known therapeutic value in the human body. That's bromide and fluoride. And we we were again designed by our maker to have iodine receptors all over our body, but it's concentrated in our glandular tissue. And the glandular tissue consists of the thyroid, ovaries, uterus, breast, prostate, and pancreas. And iodine's main job in this glandular tissue is to maintain the normal architecture. So if the iodine receptors are bound with iodine, they're iodinated, we should have a normal architecture of the glandular tissue. If if iodine is lacking, it can set the stage for problems in the glandular tissue, which we can talk about. Um, the one thing that I'll start off with is that, you know, we, we can live in an iodine deficient area, but the problems with that are exacerbated by exposure to those toxic halides, fluoride and bromide. Before we went live, you were telling me that Calgary just reintroduced fluoride back into the water supply. Um, Fluoride is there's no known therapeutic value of fluoride, and I'll include that with the teeth. We do know fluoride can make for stronger enamel on the teeth, but fluoride can also be associated with um, osteosarcomas and mottling on the teeth as well as many other problems. And I think that the purported benefits of fluoride on the teeth just haven't proven out over time. Most of the world has removed fluoride from the water supply because they realize that the cavity rates, which have declined across the world since World War II, declined at equal amounts whether a country was fluoridated or non-fluoridated. that in itself should rule out that we're fluoridating our water supply. Um, but iodine deficiency is a real thing. You were mentioning that, you were asking if Calgary's in the goiter belt. The goiter belt is a term for the Midwestern United States and Canada, that all the states in the country, Canada, that surrounds the Great Lakes, which in the US it's, Wisconsin, Illinois, Indiana, Michigan, and Ohio. And uh, Ontario, and I'm not sure what goes north of that in the
Yeah.
provinces, but all those states that surround the Great Lakes and, Lake Superior to the north, in Canada. And the soil is one of the most iodine deficient areas of the world. And, we're suffering from that. Now, iodine levels can be higher near ocean, which is the highest amount of iodine in the world is in the oceans. But iodine that comes out of the oceans through waves hitting rocks and, dispersing small droplets of water, it doesn't go very far into inland. And um, because of poor farming techniques and the use of pesticides, insecticides, and herbicides that have these toxic halides as part of their chemical makeup, fluoride and bromide, the iodine deficiency epidemic that I'm seeing in my practice, and I've talked to my colleagues in Canada, I've talked to my colleagues in the US, and I've talked to my colleagues in Europe. We're all seeing, iodine deficiency, and I think it's playing out in the glandular problems that are so prominent out there. Problems with the breast, ovaries, uterus, pancreas, thyroid, and prostate. So I don't know if that was too long of an introduction, but
That's great.
throw it back to you at this point.
Yeah, so well, I'm curious because I've heard you mention before in other conversations Dr. Broda Barnes' book. One of my favorite books ever, the Hypothyroidism, Forgotten Illness. I really enjoyed it because I find it's very user friendly. He speaks in very plain terms that a lot of people can understand. And his argument really is in that book. You mentioned all of the glandulars, but Dr. Broda Barnes' argument is that it all starts at the thyroid. It's all there, and then that's the downstream effects that we're seeing affecting outcomes in cardiovascular disease or breast cancer or ovarian failure or whatever. Like he's saying, there is a downstream effect. One, do you agree with that? And do you think that iodine is a key player in that consideration?
So Brodo Barnes wrote the book Hypothyroidism, The Unsuspected Illness over 50 years ago. And he was a family doctor in Connecticut. And he wrote about his experience in treating patients, hypothyroid patients, with natural desiccated thyroid hormone. And he felt that the diagnosis of thyroid was a clinical diagnosis, and that the laboratory, when the laboratory TSH, T4, T3 came into vogue in the 1970s, it decreased the amount of patients being diagnosed hypothyroid, and he felt that was a mistake, and wrote about his experience with using thyroid hormone. Now he didn't mention iodine much in that book.
No.
Um, the his use of desiccated thyroid hormone was one of the first things that I read about, and in the first when I read his book and I started really doing a complete exam and, honing my skills, and I started diagnosing a lot of people with thyroid disorders, hypothyroidism, Hashimoto's disease, other autoimmune thyroid disorders as well. And I was treating people with thyroid hormone as part of a holistic treatment regimen using other things, but I didn't really know about iodine in the first 10 years of my practice. Now, what I found was that in that first 10 years of my practice, after reading Dr. Barnes' book, starting drawing blood tests and evaluating my patients and honing my skills, particularly how to palpate a thyroid with my hands, um, I I was diagnosing a majority of my patients with thyroid problems. And I would say by the end of the first 10 years of my holistic practice, I had about 75% of my patients on thyroid hormone. Now that was bothering me
Yeah.
because I couldn't figure out, why do all these people need thyroid hormone to feel well? They're all the main complaint of patients. Then the main complaint of patients today is they're tired.
Yeah.
Everyone's tired. They're tired of being tired. Varying degrees of tired is the biggest complaint I hear in my practice. I still hear it. And one of the common cardinal signs of hypothyroidism is being tired. So if I diagnosed hypothyroidism, put people on thyroid hormone, a lot of times that fatigue would get better or go away. And again, I have 75% of my patients 10 years into my practice on thyroid hormone. I feel I'm helping them. I'm feeling doing a good thing. But there was a gnawing feeling at me. Why are so many people needing thyroid hormone to feel good? I don't think we were designed that way by our maker that just because we're getting older, we need to take some thyroid hormone to feel good.
Mhm.
So I started looking at the physiology and biochemistry of the thyroid gland. How does it manufacture thyroid hormone? What does it need to manufacture thyroid hormone? What are the cofactors it needs? And the cofactors are things like magnesium, vitamin C, B vitamins, selenium, and iodine's a big cofactor. Now, you can't make thyroid hormone. In fact, you can't make any hormone in the human body without enough iodine. Every gland that makes hormones needs and requires iodine to be able to manufacture those hormones, the thyroid included. Now, the thyroid gland manufactures primarily T4, um, thyroxine, and the 4 refers to 4 atoms of iodine attached to that thyroglobulin molecule. In the periphery of the body, that's converted into T3, the active form of thyroid hormone, when one iodine atom gets cleaved off. But the T3 refers to 3 iodine atoms attached to that thyroglobulin molecule. That's what binds to receptors throughout the body and gives the effects of thyroid hormone. For example, if we have enough thyroid hormone binding to its receptors, people aren't tired. They can produce energy. People's hands and feet are frozen cold in the middle of the summer, much less the winter. They're not losing their hair. They're not puffy. They're not, face all swollen up and full of fluid. Um, so so I would over those 10 years look at the various cofactors and try, I was checking levels on people magnesium, selenium, vitamin C, B vitamins, and then correcting deficiencies when I found them. But nothing worked as well as that thyroid hormone. And I was always fascinated on iodine. I knew where I live in Michigan, um, 30 minutes away from the Ontario border, that, the Great Lakes states that we're in the Goiter Belt. Our soil is one of the most iodine deficient areas of the world. And um, I figured we must all be, I figured we're iodine deficient because iodine levels have fallen in our food supply over the last 50 years.
Mhm.
Back then, nobody was taking iodine as a supplement. Nobody really knew about it. And I didn't really have a great test to check for iodine. I didn't know how to test it. I didn't really know how to evaluate it. But I was reading these articles, and iodine's very confusing. There's all these different charges on iodine, and different receptors in the body utilize different forms of iodine. And there was a lot of misinformation on iodine that I found, 30 plus years ago when I started looking at this. And I would try iodine in my practice along with selenium and magnesium and vitamin C. I tried small amounts of iodine, medium amounts, and large amounts of iodine, but it never worked like putting people on thyroid hormone. And I couldn't really change the thyroid hormone dose. It didn't really matter. They didn't feel worse. They didn't feel better at what I was doing. Now, I was using the form of iodine, iodide, DIDE, the reduced form of iodine only, because it was the only form of iodine was ever brought to my attention in medical school. We didn't hardly have any instruction on iodine.
Mhm.
Um, but iodide in the form of SSKI was the only prescription form of iodine out there, and I thought that's what you use. So tried it didn't work. I get frustrated with it, and I put it aside. And then about the 10-year mark into that practice, a physician wrote a letter to one of my journals that I get that he developed an iodine loading test. His name was Dr. Guy Abraham. He was in California. I saw the letter. It was a little 2 or 3 paragraph letter. It wasn't much. And he developed an iodine test. Now, at that point in my career, there was no great iodine testing out there. I called him, and um, he became interested in me because of where my practice was. He knew about the goiter belt. He was the world's expert on iodine at the time. And he, he asked me to fly out to California to meet him, and I did. And we formed a close friendship. He was like family to me. Um, I don't know if I mentioned his name, Dr. Guy Abraham,
You do.
but he he so we started doing research, and um the I would fly out to California 4 to 6 times a year and spend long hours, long days in his lab. and then fly back to work and work the following week. Um, and I never enjoyed being in a lab. I don't like bench work. I don't, it's just not my thing. I'd rather be in front of people and and doing what I was trained to do. But Dr. Abraham taught me about iodine more than he'll ever know. Um, and he taught me why I was using the wrong form of iodine and why it wasn't working in the body. Once I started using the right form, which was a combination of iodine and iodide, the reduced and oxidized form of iodine, I started to see the results I was looking for. Dr. Abraham and I tested thousands of my patients, and what we found was that over 98% were deficient in iodine, the vast majority severely deficient in iodine. Um, and the only ones that weren't deficient in iodine were reading some of the things I was writing on iodine and taking iodine on their
Mhm.
own. Otherwise, you can't get enough iodine from food, and not in our toxic world with our exposure to toxic halides. So I started putting people on a combination of iodine and iodide, which is Lugol solution or tablet of Lugol solution. And all of a sudden, my patients who were doing better on thyroid hormone were doing better yet. And what I found was that it was able to reduce the amount of thyroid hormone I was prescribing significantly from 75% of my patients on thyroid hormone at the beginning mark to now less than 25% of patients on thyroid hormone. So I was able to reduce it threefold, yet patients were feeling better. They were doing better. And I was actually treating the underlying cause of a lot of thyroid problems with the iodine versus not treating it with the thyroid hormone. One little side, and then I'll let you ask questions. In that first 10 years, there were two articles that came out from researchers that said the first article was the longer a woman, they compared women who took thyroid hormone versus women who didn't take thyroid hormone and the relationship to breast cancer. And what they found was that women who took thyroid hormone for over, I believe it was 10 years, had a 50% increased risk of breast cancer versus women who didn't take thyroid hormone. Now, I looked at that study and I thought that doesn't make sense to me. I thought hypothyroidism would predispose to breast cancer, which there are many studies that say that. Why does taking thyroid hormone, in this study, perhaps change that risk? So I saw that. I looked at the study. I'm pretty good at reading studies and I'm pretty good at evaluating them. I I couldn't find a lot of flaws in it, and I couldn't reconcile it to myself. And I basically put the study aside. Then the same researchers a short while later came up with another study that said the longer you take thyroid hormone, longer women took thyroid hormone, the increased risk of breast cancer. So if they took thyroid hormone for 5 years, there was no difference in breast cancer of women who took thyroid hormone or didn't take thyroid hormone. Over 5 years, the risk of breast cancer increased 50%. Now, here's a second study showing similar to the first study. Just the longer you took thyroid hormone. I'm like, what the heck is that? And I couldn't answer it. Then I meet Dr. Abraham. Then everything settles down with me, and the studies were bothering me. And once I learned that the breasts were the second major source of iodine, the ovaries the second or third. Breast and ovaries are right together with one another. Thyroid, the highest concentration of iodine in the breasts, the ovaries number two and number three, depending on which studies you read in order. And iodine's main job in these glandular tissues is to maintain the normal architecture. So if we have enough iodine in the glandular tissue, the thyroid, ovaries, uterus, breast, prostate, and pancreas, we should have a normal architecture, which I'll signify here by this pen. In iodine deficiency, what happens is you get a disrupted architecture. In the beginning, you get cysts, such as fibrocystic breast disease, fibrocystic ovaries, um, and you can get cysts in the uterus, cysts in the prostate gland. If it goes on longer, those cysts become hard and nodular. Now you can have hard nodules in the uterus and thyroid and the pancreas, you know, and if it goes on longer, it takes a hyperplastic appearance. Um, uh, if you analyze those cells under a microscope, from a biopsy, if it goes on longer, cancer is the end of that road.
Okay.
Now, this has been shown in animal test tube and human studies, and the same different animal, similar studies, animal test tube and human has shown iodine to be able to halt and even reverse this process. So I say that iodine deficiency is was cause, for those two studies that I just mentioned for putting women on thyroid hormone, the longer they took it, just putting women on thyroid hormone compared to women who didn't take it, had higher risk of breast cancer. And the longer they took it, the higher the risk went up yet. The reason was if you give someone thyroid hormone who's iodine deficient, you're increasing the metabolic rate of the body. You're actually increasing the body's need for iodine. And the iodine deficient tissues of the body are going to be more stressed. Um, so that was the conclusion of those two studies. It was almost like it hit me in the forehead when I saw it, and I'm like, now I'm starting to understand it better. So before putting people on thyroid hormone, now what I do is assess their iodine levels. If they're low in iodine, put them on iodine. Wait a little bit, see if the thyroid sort of perks up on its own, and then put them on thyroid hormone. I never put people on thyroid hormone now without assessing iodine levels first.
I have so many questions. So one, were these studies that you referenced, were they synthetic thyroid or did they also include natural desiccated?
Those were just on T4 only thyroid.
Okay.
Um, they did not include desiccated. Now, desiccated thyroid has more iodine in it than T4, levothyroxine or Synthroid. Um, so
Does
that is where one of the benefits of using desiccated thyroid hormone, natural thyroid hormone over the synthetic thyroid hormone.
does the burn rate of iodine increase the more stress a body is exposed to, just like other minerals? Like we see a burn rate will increase with magnesium if someone is under a lot of stress. Is it the same? Because iodine is a mineral.
So that's a super good question. Um, Recall in my, when I was perhaps talking too much earlier. And I said to you that if you put someone on thyroid hormone who's iodine deficient, you're going to increase the body's metabolic rate or the burn rate, as you're using that term. And that's going to make iodine deficiency worse. And that's why in those two studies they showed increased breast cancer in women who were taking thyroid hormone versus not taking thyroid hormone. And the longer they took thyroid hormone, their breast cancer rate increased. So yes, the answer to your question is yes. More stress, more metabolic, more strain on the metabolism of the body, or trying to increase the metabolic rate of the body through thyroid hormone will worsen iodine deficiency.
Yeah, it's so that kind of push that a lot of people do now, pushing their body, you're increasing the demand or the burn rate of all these different nutrients and minerals. And that can then, I know it has a direct effect on the thyroid, but it can also present as thyroid issues if even if there isn't a thyroid issue.
Correct.
Cool.
You can have hypothyroidism from primary hypothyroidism. You can have hypothyroidism from the body not producing enough thyroid hormone. You can have hypothyroidism from the body not having enough iodine, which will lower the production of thyroid hormone. You can have hypothyroidism from pituitary or hypothalamic problems, in the brain not sending the signal down to the thyroid. So there's very many different ways you can have hypothyroidism, but the worst thing to do is treat hypothyroidism without assessing iodine status first.
So how I'm assuming, before I get to my next question, I'm assuming you still feel the iron loading test is the gold standard for testing.
So there's two ways there's a couple different ways you can check iodine levels in the body. Dr. Abraham and I did saliva serum levels, and we looked at iodine's supposed to concentrate in the glands, which your saliva glands will concentrate iodine when you take iodine. So you can measure saliva serum to make sure that it's getting in from the serum into the saliva. You can test serum levels, which is a blood draw. Um, Urinary levels is a better way, just as a it's the more established way, and there's more reference ranges for that than any other thing out there. So there's two ways you can check iodine. If someone is not taking iodine as a supplement, you can do urinary excretion tests and spot urinary iodines, which mean just pee in a cup, go see what the concentration of iodine is in that urine.
Mhm.
And um, those are okay if people aren't taking iodine. Once you take iodine, since 98+% of ingested iodine, it doesn't matter how you take it, you can rub it on your skin or something, even though that's not the best way. But 98+% of iodine ingested or absorbed will be cleared out through the kidneys. And we don't have reference ranges once you're taking iodine for what that number is. Now, also keep in mind, we're not camels. We don't have humps and we don't store iodine. So if you're taking iodine, your kidneys are going to clear 98 plus percent of that out on a daily basis. You need to have a continual, ongoing ingestion of iodine to keep the levels up in the body. Otherwise, if the environment is low in iodine and you stop taking it, your levels will just crash
Mhm.
within 24 to 48 hours.
So do you think you mentioned Lugol's? I'm not going to put words in your mouth, but is Lugol's your preferred form of iodine, whether or not it's in tablet form or liquid form?
So Dr. Lugal in the mid 1800s developed Lugol solution. He was able to add potassium to iodide and get it into solution. Came up with Lugol solution.
Mm.
So 5% Lugol solution has a combination of iodine and iodide. One drop is 6.25 milligrams of pretty close to 50-50 iodine and iodide. It's not quite 50-50. Um, and therefore, two drops is 12.5 milligrams. Um, um, the human body primarily the human body has receptors for both iodine and iodide. Different tissues of the body primarily uptake and utilize iodine, the oxidized form, and iodide, the reduced form. Those are fancy terms. All they mean is there an extra electron in the outer shell of the iodine or not? If there's an electron lacking, it's iodine, the oxidized form. If it's full, it's iodide. Either way, the the thyroid gland preferentially takes up iodide, the reduced form. The breast tissue takes up iodine, the oxidized form. So there, there's about this has been measured in six tissues of the human body to preferentially take up one form or the other. Um, so even though it has been measured in the other tissue, I'm sure it's the same thing. Some are going to take up iodine and utilize that. Some are going to take up iodide. So the question I ask to audiences when I'm lecturing at this point is, what's the best form of iodine for a whole body effective iodine? One that has both forms in it. And Lugol's is perfect for that. And Lugol's is relatively cheap and it does the job pretty darn well.
Cheap in America, not cheap in Canada.
Oh, sorry to hear that.
Nothing is cheap here. So, a lot of people don't know that you can get Lugol's in tablet form, which would be iodoral primarily, and then there's another one. I was looking at it yesterday, and it's pretty expensive again for Canada. It was like 130 for this pill, but it doesn't seem to be so as common as the Lugol's liquid.
Lugol's liquid is a lot. Look, things aren't cheap here anymore either. Everything's gone up in price. But Lugol's the liquid form is cheaper than the pill form. Um, you know, I was having problems with some of the pill forms of iodine, and I started manufacturing my own so I can ensure that it's the right percentage of iodine and iodide in there. So you got to be careful when you buy things over the counter. I mean, um, I believe in Canada, I'm not, I don't think you need a prescription for Lugol solution. I think you can get it
No,
right from the
you can
pharmacy.
get it on Amazon, you can get it in the store, yeah.
That's so 5% Lugol solution is one drop is 6.25 milligrams of a combination of iodine and iodide. Two drops is 12.5 milligrams. If you find Lugol's 2%, it's not 5%, so you got to get close. Double that dose. It's not quite the same, but it's close enough. And so you do two drops and four drops to get those numbers.
So this is the one I just found it. It's from a company, True Life Therapeutics. It's Lugol's tablets, iodine, and it's 6.25 milligrams per tablet. 90-day supply. You're going to need at least four tablets a day, if I'm correct, to dose properly. So that's not going to get you very far, and it's $130
My
Canadian.
suggestion is because I've seen problems with iodine tablets on the market, big problems. Either use a trusted source or go with Lugol solution.
Do you like the iodoral one? Because Lynn references that one in a lot of her talks as well.
You know, I think it's best to go with trusted sources of it. like Lugol solution.
So just for the audience again, we want both forms of iodine because different forms of iodine work differently on different tissues or cells. And this is why, as you mentioned earlier in the conversation, that it was only when you started using the two forms that you started to see the benefits in your clients. And oh my God, it's working like eureka.
It did not work with iodine alone, and in tablet and liquid form of Lugol's, you can tell the difference because iodide has no color to it. It's just a colorless product. If it's Lugol solution, whether it's tableted or liquid, it's brownish color. The iodine, the oxidized form, has a brownish color to it. Iodide won't have that brownish color to it. It'll either be white in a tablet or it'll be clear in a liquid solution, which is not the correct form of iodine to use. So if
And
your iodine tablets are turning white over time, um, there's a problem with that.
And it stains. I have stained so many towels and tops. You got to be careful.
That's the
I've
one.
established now I do it over the sink or the bath, and that's my safe space. So, how prevalent, Dr. Brownstein, do you think iodine deficiency is now? I know you referenced what you were seeing in your clinic, but overall now, because the WHO is saying it's 4 in 10 people, but I don't fully trust everything they say either. And I would guess, based on percentages of hypothyroid, that it's probably a lot higher.
So first thing is I wouldn't trust a word out of the WHO, period. And we just dropped out of the WHO, which I am very happy. I'm cheering, and it's the best thing we could do. The WHO was a disaster during COVID. They don't deserve any of our support right now. But so it depends on what you think the RDA for iodine is. The RDA in the US is recommended daily allowance. You guys have a different name for it. What's the name? Do you
No,
guys use RDA?
we use RDA, yeah.
We use RDA. All right. So the RDA was established in the 1920s from studies done in Michigan and Ohio, the state next to us. And um, the we're in the goiter belt in the 1920s as the U.S. expanded from East Coast to West Coast. Um, the there was a problem in the Midwest United States. It was a countrywide problem, but it was concentrated in the Midwest, in the Great Lakes, and then just draw a line down, and down through Texas, and whatever went down to the U.S. You could draw the line up. It was the same line up through Canada, and there was a goiter epidemic occurring. The thyroid sits in the lower part of the neck. It weighs about 1.5 ounces. It produces about a teaspoon of thyroid hormone for a whole year. And people's thyroids were so little variations in that teaspoon affect the whole body since the thyroid hormone is required by every cell in the body, just sort of like iodine. I wrote a book on that. That was the book that I wrote. I
Yeah.
referenced that Brodo Barnes book that we mentioned earlier. Um, so there was a goiter epidemic, and this became aware at the highest levels of the U.S. government. There was a worry at that time. The worry wasn't so much people were having goiters because the goiters have been around. If you look at the old art, you know, old pictures of
Mm,
women, a lot of them have
yeah.
swollen
Yeah,
necks
yeah,
in
yeah.
these old
I
pictures.
just assumed they were just very overweight, and I never even recognized it now until you have
Well, start
mentioned
watching their necks. You'll see the goiter. There's goiters all over, a lot of old art,
it. Mm,
from Italy and other places. Um, so people can live, we were designed by our maker that we can survive a low iodine area. We can survive, we can procreate, we can have babies, but we don't live very long and we'll die at an early age and we'll be sick throughout our adult life if that's the case. And we pass this along to our kids. But anyways, so this goiter epidemic was occurring in the 1920s, and the U.S. government became aware of this and was worried about it because the worry was that not only were humans having a goiter epidemic, the farm animals were having thyroid problems. And the farm animals were not growing to the correct size, they were not procreating correctly. And there was a worry as the population expanded from east to west across the United States that the food supply would not keep up, the animal food supply would not keep up with the human population. And question was, where were we going to be able to feed the population of the United States as we expanded and landed across the country.
Mhm.
So the worry was more in farm animals than humans. So there was a doctor in Ohio. Oh yeah, I'm blocking his name. It's in my book, and I talk about that. There was a doctor in Ohio who was tasked with doing a study on farm animals to figure out the lowest amount of iodine that could correct the goiter epidemic that was the thyroid epidemic that was happening in animals. I just can't come up with his name, and I'm not gonna be able to find it right now. But um, the reason he was tasked with it was he wrote a paper on iodine in medical school saying that iodine deficiency was a big problem and that there were references to iodine treating goiters from the 1800s from some other researchers in South America. So it was known that the Great Lakes was iodine deficient in its soil, food, and water. And he was saying perhaps we need to correct this iodine deficiency to correct the goiter epidemic. So they tasked him with doing a study of farm animals, and he put varying amounts of iodine, he used Lugol solution, in animal feed to figure out the lowest amount of iodine needed to correct the thyroid problems, the iodine deficiency problems that were occurring in the animals. He did figure that out, and from that he estimated how much humans would need, the minimal amount of iodine to prevent goiter of the thyroid in humans. That's what the RDA was established on 150 micrograms per day. It wasn't the optimal amount of iodine for the breast, the ovaries, the uterus, pancreas, and the skin and the brain and the hair and whatever other tissues you want to mention in our body. It was the minimal amount of iodine to correct the goiter epidemic in humans. And um, that's how the RDA was established. It hasn't been changed since then. Um, and I can tell you that over time since then, our iodine deficiency epidemic has worsened because of our exposure to toxic halides. Fluoride and bromide have gone up through the roof compared to what our predecessors back then were exposed to, which is, I think I mentioned earlier about competitive inhibition. Did I talk about that? I
No,
don't think
not
I
really.
talked.
No, I was going to
So
ask
in,
it anyway.
so in the halides, remember the order of the halides, it's bromide, sorry, it's fluoride, chloride, bromide, and iodine in order of size. Two are essential, chloride and iodine. Two are non-essential toxic items with no known therapeutic value in the human body. And I'm including fluoride in that as well,
Mhm.
but fluoride and bromide. And they're competitive inhibitors of one another. So we have iodine and chloride receptors throughout our body. Every cell needs and requires both of those items. And if we're deficient in one of those two, such as iodine, and we get fluoride and bromide in our body, fluoride and bromide are going to bind to those receptors. And that's not how we were designed. That's not an optimal thing. Problems are going to develop. So you can also reverse that and competitively inhibit fluoride and bromide out of the body with taking more iodine. So because of our exposure to fluoride and bromide, our requirements for iodine are higher than our grandparents and our great grandparents and our great great grandparents and so on and so on. And I think that that's why we're seeing in our countries, because our numbers are about the same. 1 in 7 women. I know in the U.S. I don't have the exact numbers for Canada, but they're very close.
Mhm.
Because I've lectured through years ago. I did some lecturing through Canada and through Calgary. Um, 1 in 7 women are at lifetime risk for breast cancer. 1 in 3 men for prostate cancer. Thyroid cancer is the fastest growing cancer. Pancreatic cancer's epidemic rates. When I was in my training, I saw pancreatic cancer back in the day. It was old people, it was drug abusers, and it was alcoholics. Now I'm diagnosing pancreatic cancer in people in their 30s. Um, Diagnosing breast cancer in young girls in their teenage years now. Went to a funeral of one of my patients in her late 20s dying of breast cancer. This didn't happen 35 years ago. It wasn't even out there. Men, I'm diagnosing men with prostate cancer around 40 or low 40s now. I say it's all from this iodine deficiency epidemic that's gotten worse over time. Um, so either we recognize this, either we rectify this, or we just go on with bad health. And eventually it's going to sink both of our countries because we're not going to survive the health crisis that we're both in.
So this iodine halide relationship is what some practitioners will refer to as molecular mimicry. that if one molecule is not there, the other one will come in and almost pretend to be it and signal the same activity except in a negative way. And I've spoke about this in the case of minerals overall before, that you can displace the bad minerals with a lot of the good minerals. So if you overload your body with a lot of good minerals, and I use the term very simply for people to understand, then we can almost push out a lot of the bad ones, or push them off the receptor. So in saying that, iodine can help displace bromide and fluoride from the body. Therefore, it has a protective mechanism. And I can't remember who said it before, and I don't know if it's so valid, but someone somewhere said that if you know that your water is fluoridated and you're having a bath, for example, that if you add a couple of drops of iodine to it, you can protect yourself from absorbing the fluoride that might be in the water. How true do you think that is?
All right. So if you think about the size and the group 17 of the halides, the order of their sizes are fluoride, chloride, bromide, and iodine. So if you want to really competitively inhibit iodine, if iodine is a choice to competitively inhibit, the one molecule that's more effective is going to be bromide because it's so much closer in size than fluoride, which is really small. So the bromide is in food and drink. It's brominated oils in food. It's in medicine as bromide is a chemical makeup of a lot of asthma medications and some psychiatric medications. Um, Fluoride's in, of course, the water supply, and it's in toothpaste, and it's in you know kids' drinks, and dentists are using fluoride gels and things like that. Um, but bromide is a much bigger competitive inhibitor than iodine and then fluoride. Now, Dr. Abraham and I looked at this. We 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 could absolutely find the bromide iodine competitively inhibition connection. And I wrote about that in my book, my iodine book.
I have it, yeah.
And the we did try and find the fluoride iodine competitive inhibition, and we couldn't document that. And the reason we couldn't document it is we believe fluoride is so small, it's such an electronegative, so small of a molecule, it is really toxic to the body. It's one of the most toxic things to the human body. It poisons hundreds and hundreds of different enzymes in the body, and it that's not competitive inhibition, that's full-on inhibition. The enzymes are destroying these chemical reactions and never come back. So the human body does not like fluoride coming in and will bind it away tightly, mostly to the bones, um, and to, you know, bony areas of the body. But Dr. Abraham and I could not demonstrate fluoride coming out at huge amounts when we gave people iodine. And we could do that with bromide. So I don't know. So the answer to your question is putting it in the bathwater. I don't know if that, I don't think it's a bad idea. I don't know if that's going to work or not because we couldn't demonstrate that. Um, the best idea is to put filters on your water so you're not getting fluoride in. The best idea is tell your government to stop putting toxic substance and known neurotoxin and known carcinogen in our water supply and not giving us a choice whether we want to drink it or not. But
Well, Dr. Brownstein, if you find a government that actually listens to its people, please let us know. And
you
then
let me
we
know too.
can.
You let me know too.
So I just wanted to go back to um, the receptors on every cells. Iodine is I have not heard you ask this, and maybe I'm totally off the point or mark here, but so we didn't discuss the transport system of iodine through the cells, which would be the symporters. So if you touch on that really quick, that would be great. But also, I'm curious because you speak about sodium and how it's essential as well for all life and not just for helping the body deal with new exposure to iodine if it's not used to it. Is there an involvement there in the sodium potassium pump helping the iodine get into the cell?
You go, girl. Um, well, look what we have here. Um,
Wouldn't you know?
I've written 17 books, and I practice full time. I practice with my girls now who are both doctors and having the best time of my life. Um, and the books are easy for me to write because I write about what works, and I'm looking at biochemistry and I'm looking at physiology all the time. So the the "you go girl" comment was that is a really good question, and you really know what you're talking about. Um, the When you take iodine in, so iodine, every cell in the body needs and requires iodine. It's concentrated in the glandular tissue, thyroid, ovaries, uterus, breast, prostate, pancreas. We've talked about that a few times. And so when it's concentrated in your thyroid gland or your breasts or whatever, any of the other tissues, that means you have a higher concentration here or here than what's in the serum. So to get iodine to move from a lower concentration area, such as the bloodstream, into a higher concentrated area, such as the thyroid or the breasts or the ovaries, um, you have to have a transport mechanism to do that. The transport mechanism is known as a sodium iodine support symporter. It's like a little taxi cab. And that taxi cab on one, you got a driver, the taxi cab, and then in the back seat is an iodine molecule waiting to be driven over the cell membrane so it can be deposited in the thyroid or the ovaries or the uterus or the breast and to do its job. And in the other side of that passenger seat is a atom of sodium. So you need I'm sorry, it's actually there's two sodium atoms back there. So there's three atoms in that back seat.
It's a
You
bit
need two
cramped.
atoms of sodium to one atom of iodine to transport across that cell membrane. So if you don't have enough salt coming in the body, when you take iodine, you're going to make salt deficiency problems worse. Similarly to you take thyroid hormone, you're lacking iodine, you're going to make iodine deficiency problems worse. Salt deficiency is a huge deal out there. Most people are salt deficient. Um, you should have sodium levels of 141 milliequivalents per liter or higher, um, and chloride 103 milliequivalents per liter or higher. And so I don't put people on iodine without putting them on salt. Unrefined salt is part of that regimen. And it's an ATP dependent process. So the car, as it's moving iodine and salt over that border into the thyroid or the breasts or wherever else, you're going to burn up an energy molecule to do that. Um, Now, the good thing is once iodine gets there and starts making thyroid hormone, you'll replenish your energy molecules. But salt's a key factor in this process.
Yeah, but we're not talking about like standardized table salt because again, it
Now,
is the sodium potassium pump, so you still need the potassium as well.
does that picture look like standardized table salt? Hell no. It's unrefined salt. Um, and you're right on that one.
So
But we are talking, if we're just talking sodium and we're just talking chloride, even Morton's table salt or just regular, lousy table salt can do this job that we're talking about. But it's better to get your other minerals in salt as part of a holistic treatment regimen than just relying on sodium and chloride only. Plus, there's toxic items in unrefined salts, such as ferrocyanide, aluminum silicate, and some other things that shouldn't be in there.
so we can do the job, but it's not going to do it optimally. And then the more you
No.
develop a deeper potassium deficiency, then things are going to start going wonky there. I had another question for you. This taxi that you refer to, can this taxi where an iodine deficiency is very present, can that taxi take bromide and fluoride over into the cell? Does he, or is he just biased and he only takes iodine and salt?
You go, girl, again. Yes, it can transport it's a competitive inhibitor. So if there's too much bromide, it'll open the door, kick the iodine out, and it'll come in there. And you can actually brominate thyroid hormone. So the T4, the testing that we have right now telling us T4 is whatever and T3 is whatever on a lab test, we don't really know whether that's telling you it's iodinated, 4 atoms of T4 is got 4 atoms of iodine on there, or one or two or three or 4 atoms of bromide on there. Same thing with T3. In animal studies, if you give them overload them with bromide, they will brominate their thyroid hormones. Now, there haven't been any research on what the consequence of that is, but it's not going to be good. That's not how we were designed. That's not how it's supposed to be done. And we know bromine toxicity and fluoride toxicity exists. And the old bromine, before my time, I'm older than you, I'm pretty
I
certain.
just have some very good practices.
Um, I'm pretty sure I'm older than you, but um, before my period of time, bromine was in a lot of over-the-counter stuff. Um, do you guys have Alka-Seltzer?
We did in Ireland, we don't here. We did in
So
Ireland.
Alka-Seltzer is little tablets that you put in water when you have an upset stomach, and
It's
it raises the pH of the stomach. And it used to be Broma-Seltzer when I was young, and then before my time. So they would sell these over the counter, and there was many other bromine products sold over the counter in before 1970 that people would get bromine toxic, and they'd show up in the emergency room delirious, they can't stand, or they're falling down, and they were suffering from bromine toxicity. And you know what the treatment for bromine toxicity is?
called
They
display.
would give them saline IVs to try and competitively inhibit bromine out with chloride. What they should have done was done the same thing with iodine, and it would come out much quicker. Um, but that's the old time treatment for bromine toxicity. And fluoride toxicity is a much harder problem to develop because it's such a small electronegative molecule. It poisons these enzymes and it binds so tightly in the body. That's a bigger problem. Something you really want to stay away from.
So you mentioned a few minutes ago that iodine is mostly stored in the tissues, the thyroid, the breasts, ovaries, and so on. That would lead me to think then if we were looking at a gold standard of testing iodine amounts in the body, we would be looking at tissue testing, which nobody's doing, but in an ideal world, that would be to get that 100%. This is how much iodine is in the tissue and what it's doing here.
No one's doing it. And the bigger problem with this is your third you go. Those are really good questions. The bigger problem with that is fluoride, at least bromide, we can measure. And bromide and iodine both cleared out of the urine, and you can competitively inhibit one without the other. Dr. Abraham and I talked about that. I put those studies in my book about that. Um, the bigger problem I see is fluoride. Fluoride toxicity is just a disaster, with cancer and neurologic problems and um, pineal problems. And the only way that's ever going to be elucidated with how much toxicity of fluoride is through bone biopsies, since the body tries to bind fluoride to the bone, but it works okay when you have thick, strong bones. But as you get older and start losing your height and losing your bone strength, that stuff gets released and it just becomes overload to people and they start developing neurodegenerative disorders from it. So we really need to do that study for fluoride to see what the body load of fluoride is and how we're going to deal with that. The best way to deal with it is don't drink fluoridated water and don't swallow fluoridated toothpaste and don't allow your dentist put all those fluoride treatments on your teeth. Um, and fluoride should be avoided like,
The plague.
yeah, like a toxic substance that it is.
I have a few more questions before we wrap up, but one thing that's been on my mind since you spoke about the goiter belt and the way you were kind of doing the line down also gave me the idea of a peak as well in the aspect of air pollution. Has there been any research or studies looking at the concentration of air pollution in the Midlands, where the goiter belt would be, and how that would connect to what we were saying with the molecular mimicry aspect? That if the air pollution, not as visibly bad as, say, China, but if it's more concentrated in the Midlands, then that potentially is playing a part in this?
I don't think there's any studies related to goiter showing that, but the goiter studies have been very clear that iodine deficiency, bromine toxicity can all lead to goiter. I've seen it in my patients. I got case history after case history after case history of swollen thyroids improving with iodine and huge amounts of bromide coming out at the same time that that's happening. But I don't think there's any studies with air pollution showing that. At least I'm not aware of any.
Well, then, just saying that, are you aware of any issues with goiter and extreme hypothyroid issues in like China, where certain cities are very concentrated in pollution?
Well, there are a lot of Chinese studies with goiter problems because certain areas of China are really low in iodine, other areas are really low in selenium. And you can get thyroid problems from both of those problems, but I haven't seen them correlated to air pollution.
Oh, I think that would be interesting for sure because obviously the worse everything's getting, also our air is getting more polluted at the same time. So with we spoke a lot about hypothyroid, and as we wrap up, I just want to give the people with hyper or even Graves issues a bit of a look in how safe is iodine for people, or even effective for people in that aspect of thyroid conditions as well.
Very good question. Of course, I talk about that in this book. And we don't find Graves' disease and Hashimoto's and other autoimmune conditions very hard to treat at all. Iodine should be part of that regimen. It was the accepted regimen to treat those illnesses 100 years ago. And then once they developed radioactive iodine treatments to ablate the thyroid, um, the interest in iodine waned anyways after they figured out the RDA for iodine and put it in salt, and the goiter epidemic was still there, but it disappeared from view, and the animals were corrected. So the interest in iodine sort of waned at that time, and the only thing the conventional medicine is interested in iodine is radioactive iodine to treat an overactive thyroid, which I've been practicing holistic medicine for 35 or so years, and Um, I've never sent anyone for radioactive iodine treatment. It should be the last choice because that leads to increased risk of cancers and some other issues. But I haven't had to use it because you can use iodine to treat those as part of a holistic treatment regimen. I talk
Yes.
about that in my thyroid book.
So why is it then that so many practitioners or doctors and even big name doctors are warning against using iodine now, saying I've heard one recently say that iodine causes Hashimoto's, and then others, oh, you have to be careful. Really, I wouldn't recommend it, or you shouldn't go over this very small amount. Like, why is there still fear mongering?
Well, you have to ask those doctors that. But um, I have asked them that question. They can't answer it. The question is, as autoimmune thyroid disease, Hashimoto's, Graves, and other autoimmune thyroid disease gone up or down over the last 50 years?
Up,
Dramatically up. Has iodine levels, I can speak for the US, have iodine levels gone up or down over the last 50 years according to the National Health and Nutrition Examination Survey?
down,
Down. 50% down. This is a negative correlation. It's an inverse correlation between falling iodine levels and higher levels of autoimmune thyroid diseases. That in itself rules out iodine as the cause of this rapid rise in autoimmune thyroid disease. Period. Exclamation point. There's really nothing else to discuss in this. There's nothing else to debate on this. It could be iodine deficiency, which is what I say it is, causing this rapid rise in autoimmune thyroid disease. Maybe it's something else, but it ain't iodine. Period.
good.
Exclamation point.
The end. So, Dr. Brownstein, the question on everybody's lips right now, can iodine help with my weight gain and my hair loss?
Well, um, so everybody thinks thyroid hormone will cure hair loss and weight gain. It's just not the case. Now, it can when there's severe hypothyroidism present. Um, but as we talked about earlier, you're going to make iodine deficiency worse. So, first thing is correct iodine deficiency. Then you start as part of a holistic treatment regimen. And, you know, for hair loss, there are three major factors of hair loss: thyroid's off, iron levels too high or too low, and minerals too low. That's what I see in my practice. So a holistic treatment regimen can sort of identify the underlying causes of these problems and then get a plan together to treat that. It's not so easy as just taking thyroid hormone. And if iodine deficiency is present, that has to be rectified to treat those problems.
I'm sorry to jump back, but this just popped into my head. We spoke about Graves and hypothyroid there. What about people who actually have their thyroid removed? I would assume they need even more iodine because there's more demand then for the body to be supported.
So at saturation, Dr. Abram and I showed that about 2 grams, um, about around 2,000 milligrams, no, it's, yeah, 2,000 milligrams of, or 2 grams of iodine are in the human body somewhere.
Mm.
20% of that iodine's in skin. I don't have the numbers exactly in my head. It's in my iodine book. 30% in the fat tissue, 30 or 40% in the muscles, or one or the other. But the vast majority of iodine's in the skin, muscles, and fat. The thyroid has the highest concentration of iodine, but only a small percentage of the body's total load of iodine. So even if you take the thyroid out, my question to you is, do you have skin? Do you have fat? Do you have muscle? Do you have a liver? Do you have kidney? Do you have a heart? All these tissues need iodine as well. It doesn't really change how much iodine I think people need. But to your question, if their system is out of balance because they've had their thyroid out, yeah, they're going to need iodine. They're going to need milligrams amount, not micrograms amount of iodine. And the RDA was not set for optimal amounts of iodine. It was set for minimal amounts to prevent goiter in the vast majority of people, which it was successful at that. It's not so successful now because our exposure to toxic halogens has increased.
Is there a difference between the efficacy and the dosage of our iodine between men and women? Because men obviously don't have breast tissues or ovaries. Their liver tends to work better. Men don't see as many thyroid issues as women do.
So yes, women need a little. When I'm talking, when you're talking 150 micrograms, women are going to need more iodine than men. Pregnant women need more iodine than non-pregnant women. Um, but when you're talking about milligram doses of iodine, my average dose on the average patient is about 25 milligrams of a combination of iodine and iodide. If they have glandular disorders, more. 50, 100, sometimes hundreds of milligrams of that same iodine and iodide. When you get up into those milligram doses, I think you're going to give enough iodine to the body that it'll utilize what it needs, and then the kidneys and the colon should be able to excrete the excess.
So, last question, I promise. So, I'm 140 pounds. Is my dosage going to be lower than someone who is 240 or 300 pounds?
The answer is yes, but again, when you're talking 25 milligrams, 50 milligrams, 100 milligrams, the dose is large enough that it can take care within reason of 140-pound female and a 200-pound man. And do I think that the female needs 30 milligrams and the man needs 25 milligrams? You know, I think what you need to do is give enough iodine to saturate the receptors and to allow 95% of iodine, 50 milligram load to come out. So 45 milligrams comes out and the body hangs on to 5 milligrams a day. You can do that very easily with 25 or 50 milligrams in the average adult. I don't, we haven't we didn't do you're asking a really good question for that too, but we didn't do the specifics of milligram per kilogram dosing of iodine, um, and female to male versions of it. But I don't really think we need to do it, to tell you the truth, when you're talking to use these milligram doses. There's enough there that'll take care of both people.
But based on what we spoke about earlier with the stress factor, if a 140-pound woman has a lot of stress and let's say she trains very hard in the gym and her burn rate is high, whereas the 300-pound woman maybe has a very easy life that nobody has now. But let's just say hypothetically, then the 140-pound woman, because her burn rate is higher, potentially would need more.
Yeah, but more than 150 micrograms. But I think when you're talking 25 milligrams, it covers enough of that I just don't think that there's going to be that. I don't think you're going to be able to micromanage between 25 or 30, 35, just you'll give enough and then follow the levels and you can see the metabolic markers on the blood work to make sure that you're utilizing, the right amounts for that person.
Right. Well, Dr. Brownstein, this has been a great start to my Saturday morning, so thank you.
Mine too. Thank you for having me.
This was jam-packed. I'm actually surprised at how much you can fit into an hour. Others cannot do that.
Well, I'm happy to be here and I um, like talking about this stuff and let's make people healthier.
Yeah, absolutely. So I'm going to drop links for all of your books, your website, everything below. You have a lot of great conversations out there. Is there any kind of nuggets of gold you'd like to leave the listeners with?
don't settle for poor health. Don't settle for, you know, your doctor prescribing an antidepressant when you're just not feeling good and you're not, antidepressants don't work very well anyways, but you're not depressed, you're just not feeling good. And if your doctor's not listening to you and, find someone else, and it's best to work with a holistic practitioner, someone who's got iodine literacy in his or her brain. If they don't have iodine literacy, find one that does. And there's enough people out there. Um,
And don't listen to the WHO. We'll just leave it with that.
don't listen to the WHO. You guys should get out of the WHO like we got out of the WHO. I'm very proud of our government to get out of the WHO. I hope you guys will follow suit with it. Yeah, don't listen to the WHO.
I don't know.
Nonsense.
Have you seen Canada lately? I don't know what's
In
happening
Canada
here.
lately. Like we almost had what you had in the presidential election. I'm glad we didn't get it.
Yeah.
Um,
Yeah, we took one for the team again.
Unfortunately.
All right. Thanks,
We're
Dr.
still cheering
Brown.
for you here. We're not far away. I'm only 20, 25 minutes away, and I have a lot of friends in Canada, and
Well,
you know,
look,
you,
maybe
hopefully you'll come around.
if everything goes crazy, maybe you'll just take me and the rest of Canada can fend for itself. All right. Thanks, Dr. Brownstein. I hope you have a great day.
You too. Thanks for having me.